Hi everybody, welcome back to the channel. I'm Dr. Mivy Singh, your specialist doctor here. Today we're going to be looking at how can medical cannabis work and help patients who suffer with ADHD, known as Attention Deficit Hyperactivity Disorder. So why is that? Why do those patients benefit with medical cannabis? Well, medical cannabis works on the body's own internal cannabinoid system, and the way it works is, imagine if symptoms are jumping out here, and that's essentially what happens in ADHD. So what the endocannabinoid system does by giving medical cannabis is it controls that and regulates it, so it almost squishes them down into a more controlled and confined space, and that's the best way to describe it. Therefore, it allows the patient themselves to have that level of improved focus, that improved level of concentration, to also feel a little bit more calmer, that they can actually see and concentrate on their thoughts and also regulate their mood and behavior to much better appropriate levels. Where the pharmaceutical medicines work on one or two different receptors, the cannabis plant actually has so many different compounds in it that we've discussed before, which come by the nature of THC, CBD, other types of cannabinoids. Then you also have the flavonoids and terpenes. So when you get the right kind of combination, you have got many different factors of these components acting on many different receptors. So it's not just working on one, and this is known as the entourage effect. And that's why there tends to be a better outcome by controlling and acting on all these different receptors at once, rather than just acting simply on one. These patients with ADHD can also unfortunately suffer from other conditions such as depression, anxiety, as well as poor sleep. And that's the sad thing. And actually those medicines that are given don't actually treat those as well. Whereas actually the fantastic thing about the medical cannabis plant, when selected for the right patient, it can be used correctly for its profile and terpene profile to work against and lift mood, to tackle depression. It can be used as an anti-anxiety medicine to relieve the patient from those types of symptoms. And for sleep, it can be used to help regulate either the initiation or the aspects of deep sleep, and therefore help give a better sleep-wake cycle for the patient. And just like anybody else, if you have better sleep, you're feeling less depressed, you're feeling less anxious, your actual quality of life is going to improve, your next day is going to be better off, and therefore this has a knock-on effect for improving the patient's whole aspects of life. And that's why it's important to see a specialist who can select the right type of patient, go through the side effect profiles, go through and see whether you are an eligible candidate and whether it's safe and sensible to use, and go through what the benefits will be, and therefore then tailor the treatment according to an individual self. So many people are now being diagnosed with ADHD, and it comes after a long process actually that patients go through, which can be quite tough and stressful. And there's a different whole group of age ranges in which people are being diagnosed with ADHD, those which are young all the way coming to those which are much older, because they're finding now that due to increased awareness that actually they potentially might be having symptoms that could be helped and treated to improve their own quality of life. Traditionally, a lot of patients will get put on different types of medicines known as stimulants. These types of patients will typically get put on medicines to help control the symptoms of ADHD, to help them feel a little bit more calmer, to help them concentrate better, to also feel less impulsive, and learn and practice new skills and techniques. Medicines you'll know by the names of methylphenidate, lisdexamfetamine, dexamphetamine, toxametine, and guanfacine. There's obviously other types of therapy that come with the treatment known as psychotherapy, parental education, behavioral therapy, social skills training, CBT, diet, supplements, so engaging with other specialists that are involved in the care for these types of patients. A lot of patients may actually not benefit from these medicines, or actually they might even suffer side effects, and this is where medical cannabis can come into its own. So when a patient has failed 2 treatments in that pathway for traditional treatment for ADHD, medical cannabis may potentially be suitable for those patients. We've treated patients and they have benefited when they are selected appropriately and they're counseled appropriately, and also the side effects and risk profiles are also gone through, and those patients actually benefit and actually have a good outcome. And that takes us to the end of this video. I hope you enjoyed it. My name is Dr. Mivy Singh. I'm your specialist here. Remember to like, share and subscribe to grow this channel so that I can keep making good content, to keep making and producing these types of videos for yourself, to keep you informed. The last thing is, always remember, Catch you in my next video and stay blessed. Thanks for watching.